Hi everyone, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today I want to talk about Amazon in the healthcare realm. I am going to be completely honest with you. It wasn't until one of my very loyal followers asked me about this specific topic that I even really understood how much Amazon is involved in the healthcare field right now. I knew and I've heard little things here and there, but to be honest with you, it's never really affected me. I have not ever had it affect any of the clients or places that I have worked. So I was very unaware. So I had to do a little bit of research on this, which was really good for me. And I always love learning. But I was like, wow, this is a great question. It's something I'm not aware of, and it's a great topic for a video. So I did write down some notes, and I could talk about this a lot longer than this video, but I'm hoping that if you're interested as well, it prompts you to do your own research. So anyway, a few years ago, Amazon started kind of testing the waters in healthcare, and they partnered with One Medical. One Medical is a primary care group, and Amazon's support has helped them grow. They're across the United States, and it's a combination between a direct primary care model and a concierge primary care model. If you're not familiar with either of those, I actually am going to do and be releasing a video on the differences and similarities between the two, so make sure you look for that video. But it basically was something that came together because primary care, everybody knows, is kind of a quote dying specialty in healthcare. And a lot of the reason for that is high provider burnout, high provider retirement for kind of the old school. And then also the administrative burden for primary care is growing significantly, and the reimbursement is not. So the work to income ratio, the work to reimbursement ratio is not super fair compared to other specialties that these new doctors and providers can go into, where it's a little bit less administrative burden, or maybe the same administrative burden, but the pay, the results of the work is higher, the reward is higher. So people going into primary care right now are really going into it because that's where their heart is. That's where their calling is. That's where their gifts are. That's what they want to do. It's really not for the pay, because the reimbursement from all insurance companies, especially if you're a small private primary care practice, is not as good as other specialties. It's unfortunate, but it's just the reality. If you are part of a bigger group where you have more leverage to negotiate those contracts as primary care, that's great, and that's where you're going to see that. But a lot of primary care doctors don't want to work for big entities. They want to be their own boss. They want to be able to control their own patient's care. And that's why we're seeing that pendulum swing back to more primary care and private practices in general, because people have been on the other side of that swing where they've worked for larger entities and it wasn't as great as they thought it or hoped it would be. So primary care is a big area of need right now. It's a gap in healthcare. So Amazon identified that. What is it called? I have my notes here. One Medical had this design, this model that Amazon liked, and they partnered. So they have this, and they're brick and mortar buildings across the United States. It's a membership type plan. So it's a hybrid between the direct primary care and the concierge. So you pay a membership fee per person every month, and it's month to month. It can be canceled anytime. And that gives you more direct, quick response access to a primary care for reasons when you need it. You are guaranteed same day appointments, callbacks, stuff like that. Things that people are complaining about when they have a primary care, but it's taking forever to get an appointment. It's taking forever for them to return a phone call back from the advice nurse, whatever. So this is going to try to help fill in those gaps. People who have a Amazon Prime membership get a discount on the One Medical membership. And you can add, I think it was like up to 9 people. So because I have a Prime membership, I can add up to 9 different people. And the more people you add, the less amount of money per person per month is the membership fee. So you have a membership fee. It's kind of like the club, right? Like you're in this one medical club, and that allows you to have quick and easy access to primary care. And then they also bill your insurance. So it's not in replace of insurance. You use this to have insurance. So when you're treated, they bill your insurance, and then it just functions like anything else with your deductible, copays, etc. Some things about One Medical is that employers are using this as an advantage or a benefit for their employers. So I'm sorry, for their employees. So an employer might say, hey, I want to buy memberships for all of my employees. And then maybe the employee, if they want to add people to their plan, they would pay their own out of pocket for their spouses or children or whatever. And it's incentivizing employees to take better care of themselves because they have fast access to primary care. So they're more likely to go to the doctor when they're not feeling well, to do their preventive checkups when they need to go, to handle their chronic conditions. So employers are benefiting from more healthy employees. And then also it's a benefit that employees are like, wow, I have this extra benefit. This is great. So that is one angle that is very smart. And it looks like there's a lot of employers that actually use this benefit now across the United States. So you have One Medical that Amazon is involved in. The next thing is that they have telehealth. And it's very interesting because I went onto my Amazon app, and I was just curious the other night of what you could access through the app. You can add the One Medical membership through the Prime app. But I also went in and I was like, oh, telehealth. Well, the telehealth is very interesting because they kind of promote different health conditions or signs and symptoms that you might need to be seen for. And it's available 24/7 or as 24/7 as the different locations are available. So if maybe somewhere isn't available 24/7, but they're available till midnight, then in your area it would be available until midnight. So it's kind of interesting. You can click on kind of like what's going on. And I'll try to put some screenshots in this video to kind of give you some ideas of what it looks like through this video as I'm talking. But you'll go through and you'll say, maybe I'm having a sore throat, or I have a urinary tract infection, or I think I do, or there's all these different symptoms you can choose from. So then you choose that, and then it asks you some questions, and then it asks you some more questions, asks you your location, so which state you're in because of the billing, right? And make sure, all of that. But the thing is you don't bill insurance. It doesn't look like they bill insurance. I didn't go far enough to actually schedule the appointment, so I don't know. But it gave the wait time of how long I would have to wait for someone in my area to contact me for telehealth. And it also said how much it was going to be. So for a telehealth visit for a UTI the other evening, it was going to be like a 45-minute wait in Oregon, and it was $75. So that tells me that it's out of pocket, right? It's not billing insurance. I don't know what happens when you schedule, if they ask you if you have insurance and then you're subject to that. It doesn't say, I didn't see anything, but let's just say it's cash price. That's a pretty good little gig right there. I am very impressed. I don't know how I feel about the accessibility of that, honestly. I mean, I have my clinical side that's like, well, some of this isn't very good medicine because I feel like people should be putting your hands on patients to get a true diagnosis, right? Because there were some options on there. I'm like, how do they treat that through telehealth? But I know that's across the nation. It's not just Amazon, by the way. I have some conflicting feelings about that in general. And then I'm like, well, if people don't want to bill their insurance and they just want to get it done and over with, I understand that. Like you're on vacation or you don't have time to go to the doctor. So you're like, oh, well, I'll just pay cash. But at the same time, I'm like, I have a high deductible plan. So I want to get credit for going to the doctor because it's early in the year and who knows what's going to happen. So I definitely have conflicting thoughts about it. But anyway, it's there. It's in the app. I'm sure you have the Amazon app. Check it out. very interesting. There's also some other topics that I found were very interesting that they say they treat. So anyway, check it out. And then the last thing, which is the newest thing I think for Amazon, is the prescriptions. And they make it very convenient, right? It's like a mail order pharmacy. They run it through your insurance. You can pay cash, and it comes right to your door. I have a high deductible policy. I'm on a medication that is more expensive than some others. So I checked it out, and actually I can still get it cheaper at my local pharmacy through a GoodRx coupon that they have. So I definitely won't be using that for that specific situation. And I go to the grocery store enough, and I know how to plan my refills that I get my medications when I need to go grocery shopping. So it's not an issue for me, but I can see this being used a lot, especially there are so many people out there that don't shop because they use Amazon to do all their shopping, including grocery shopping, or they do click lists where they just like pull up at the grocery store and people load it into their trunk. So I could see this being really handy for people who have a really busy lifestyle, or they don't have a car, or they don't drive very much, or not comfortable. It is convenient. I would watch the prices. All medications, of course, are going to be different depending on whatever pharmacy you go to because it is retail, but that is their newest thing. It's definitely coming into being a competition in healthcare, but at the same time, I feel like people are still so used to the way healthcare is going and how it is that it will take a really long time for some of this to catch on, if it ever does. It might just be something in the background that some people are aware of and a subset of people love it and use it and it's successful, but it doesn't compete with the existing practices. It doesn't compete with the existing pharmacies. Pharmacy might be the one that it competes with the most. But telehealth, same thing. We know telehealth rules are probably going to be changing towards the end of this year, so that could be a game changer depending on what happens there. We'll have to keep our eye on it. But in general, yes, it's something to keep in mind. It's something to be checking if you're worried about some kind of competition. But at the same time, we have so many patients and people in the community that barely understand their insurance benefits that a lot of them aren't going to take the time to try to figure all of that out unless, again, their employer offers the one medical as a benefit, or they just happen to need to use telehealth and they don't have an option through their own insurance. So they go through Amazon. I mean, there will be certain situations, but right now I don't see it being super concerning other than maybe the pharmacy. But it is, again, if you're a manager, you're a provider, I would definitely keep your eye on it because things, change and trends change. And so we'll just see what happens. I didn't see what's coming down the pipeline with Amazon. So if you're familiar with any more things that I didn't talk about, that I didn't find, that I didn't mention, I would love to hear from you in the comments below because I want to hear if you've ever used any of those resources they offer, if you're aware of anything else coming down the pipeline. It would be very interesting to see if you've been affected by any of this as far as a competitor. So please leave that in the comments below. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already, and please share this with all your colleagues whom you feel would benefit. Thank you so much for the support. We'll see you next time. Bye-bye.